Hello, welcome everyone. So I am here with my dear friend Ashley today. So Ashley and I have known each other, since junior high, which I don't even know how many
Which
years
was
ago
a
that was.
very, very long time ago.
Yeah, we don't need to put numbers on it. Um, yeah, and we've really connected, I guess, since having kids. Our kids are around the same age, and Ashley went through cancer 5 years ago. And I am so thankful and grateful that she's here to tell her story. And today I just wanted her to share her story. I have some questions for her and just how she went through that very difficult time. And yeah, I'll let her share her journey of everything that happened. Yeah.
Perfect. Um, okay, so I guess we will um start at the beginning, right? So I had my second child um in 2018, October of 2018. She was healthy. I had a great pregnancy. I felt really good. And then roughly around her being 6 months old, I had an enlarged lymph node in my armpit, which immediately was a red flag for me. I had just gone through a bout of mastitis. So I texted my family doctor and he said, Ash, you just had mastitis. You've just been on antibiotics. It's pretty normal and common for lymph nodes to kind of fluctuate in size. We'll keep an eye on it, but lymph nodes do take a while to come down. Um, and I kind of took that and, agreed because all of those things were accurate. But my intuition, my gut was just telling me that it was something more. Um, so I watched the lymph node and it really didn't change. Everything basically stayed the same. I was still nursing my daughter and still chasing around a toddler. And I kept having dreams with my grandpa who would come through, and he kept assuring me that I was right. Something was wrong. Something wasn't right. I needed to keep pushing. So I requested an ultrasound. Um, that ultrasound, I even remember sitting there, and the ultrasound tech knew I was a young mom, knew I had a baby, knew I was breastfeeding. Um, And even though they're not supposed to, she had reassured me that everything was good. Everything looked good. The lymph node did not have any cancer characteristics. It really just looked like an enlarged lymph node, trying to fight infection. And I remember this is like, I don't, COVID hadn't started yet, but it was like just about. So my husband didn't come in with me, but I remember him sitting in the vehicle and I came out and I was like, well, she said everything was fine. And he's like, oh, that's great. And I'm like, yeah, no, she's wrong. I'm going to need a second opinion because this isn't right. Like, I just knew something wasn't right. I didn't have any other symptoms though. And I mean, really, that lymph node, our lymph nodes fluctuate all of the time. That's how we fight infection, right? The purpose of our lymph nodes, our lymphatic system, is to continuously drain fluids and matter that are no longer needed in our bodies. We know this, right? So I waited for my family doctor to call. He phoned, said, hey, everything looked good. The radiologist said everything looked fine. And I was like, yeah, I'm going to need a second opinion because I know that that's not right. Um, and at that point, if you're Canadian and you live in Alberta, our healthcare system is what it is essentially, right? They're very much by the book, and most doctors really didn't understand when I was like, no, but I know something is wrong. My intuition, my gut is telling me something's wrong because they are very black and white. Um, they go by the book, science, this is what it is. That's it, right? Um, so luckily my family doctor listened to me and he was able to get me into this clinic. It's called the Comprehensive Breast Clinic. They specialize in not only breast cancer, but um, everything, cysts, anything to do with boobs. And I want to say, like, within a few days, I had gotten a call from them. Sorry, I had gotten a call from them, and they were pretty urgent about it. And we're like, Kate, we need to get you in. We need to do another ultrasound. We're going to do a mammogram, and there will likely be biopsies being done, which to me was like, how did I go from this ultrasound being perfectly fine to this provider saying, actually, there's like a lot of things that we have to look. After that, the process was relatively quick. I went in, and when I was in there, you could just, there was like a real sense of urgency in that specific appointment. My mammogram showed nothing. There was nothing on there. For context, I had very little boobs. I was breastfeeding at the time, though, so obviously very dense breast tissue, but the mammogram didn't show anything. So we went to the ultrasound, and I remember from there, and if you've ever seen like any memes of like ultrasound techs and they're just like on their computer, it was exactly like that. And she wouldn't let me look at the screen. Um, and then she's like, Kate, we're gonna like, we have to biopsy here, here, here. So, um, meanwhile, I was by myself because it was like a women's clinic. My husband wasn't allowed in with me. And he obviously had no idea what was going on. It had been like hours, literally. I didn't have my phone on me. Um, and once they were done, the biopsy, the biopsies, because we did four, um, a different nurse came in and said, your family doctor will have the results within 2 weeks. And then she said, but this is relatively urgent, so it will be much faster. And obviously, I knew that they knew what I knew. Um, and so a few days had gone by because I was still breastfeeding and had had those biopsies. I had literal open wounds on my boob. So every time my milk let down, those wounds would reopen, which is extremely painful. And so I had phoned my nurse practitioner friend and was like, can I come see you? Because I think like now I have something else going on. And so she said, sure, come on in. And I remember sitting on like the bed in there and she looked at it. She said, no, it's fine. It's like a bit irritated, but the holes will eventually close up and you'll be fine. And I said, has anything come through yet? Like, is there anything in? And she said, oh, I checked this morning and there wasn't anything on there, but let me just quickly look again. It was very like casual, very like, we're just sitting there. I had known her a long time. And I just like see her typing and then I kind of like see her face just kind of go blank. And so I say, are they on there? And she said, yeah. And I said, and I have cancer. And she said, yeah. And I said, okay. So obviously very sad, but at the same time thankful that everything I had been feeling um, had finally been realized, I guess, because not that I felt brushed off, but I just had zero symptoms. So I understand how doctors would be like, we can't send you for this and we can't send you for that. And like you have no symptoms, you have no lumps in your breasts, you're breastfeeding, you're still producing milk. Like there was zero signs of possible breast cancer. And then that lymph node normally breast cancer will not be painful. It won't be squishy, it'll be quite hard and it won't be movable. Usually it will have like attached itself, whereas my lymph node was extremely painful, super tender, squishy, and is movable. So literally pointing to all the things that like this is not cancer. Um, so from there things moved pretty quickly.
Sorry, I just want to ask,
Yeah.
and if this is too hard to go back to, just let
Mhm.
me know. But when she did confirm that you had cancer, can you just walk me through like what was the feeling? What was the emotions? Like how did that feel?
Um, so the sadness for sure. And immediately, so because I have always followed my intuition and I've always followed my gut for the most part, um, when like 6 months prior to that, it took a long time for me to get diagnosed, right? Um, I had been going down like a rabbit hole of women getting breast cancer or finding out they have breast cancer while breastfeeding, which everything that I had read was like, this rarely happens. Um, Breastfeeding is supposed to reduce your breast cancer risk. Um, so I had just like, like mentally, I remember doing this to myself and it like really, really messed me up. Because I just like Google and searched everything and statistics suck also. Um, it's important to remember that statistics aren't done annually and statistics are also very across the board. It could be a 7 year old and it could be a 97-year old, and they'll put those statistics together. A 7 year old has a 7 year old wouldn't get breast cancer. Let's say a 27-year-old, 27-year-old who's diagnosed with breast cancer versus a 97-year-old, obviously they're going to be very different. And then there's also a bunch of different types of breast cancer. Again, all of those are, everything is just compiled into one thing. So the statistics suck. Um, but I felt because I had to push so hard, um, my diagnosis was going to be like the worst possible one. I kept thinking I had stage 4 just because it had taken so long to get a diagnosis. And so in that moment, um, she asked if she could get my family doctor, and I said yes. So she went and grabbed him, and he came in. And I remember he hugged me, and he's like, Ash, I'm so sorry. Um, and I said, okay, what stage is it? And he was like, I don't like, we don't know any information, but he's like, it's probably stage 2 or 3. Like, I'm relatively confident we caught it early enough. But in my body, in my gut, it just felt like a death sentence. It really did feel that way. And at that time, so I was diagnosed on September 11th, 2019. So my daughter was 11 months old. So she hadn't even had her first birthday yet. And if you've ever Googled breast cancer statistics, even stage 3 is not great. Um, but stage 4, I believe, is 20% or less make it to 5 years. And to be honest, I think it's even less now. I mean, statistics, I don't even know how old those statistics were, probably from like the early 2000s. So it's hard to judge those, but obviously they use a lot of statistics in medicine, right? Um, so I think just fear, there was so much fear. And I remember like, how could this happen to me? Like, how is this happening to me and my family? Like, what did we ever do to deserve something like that? What did my kids ever do to deserve not possibly having a mom, right? Or like my husband not having a wife? Like, none of it really made sense to me, but at the same time, there was like a sense of relief that I was finally going to be able to get help, right? That I was finally going to be able to, get on medication and start chemo and all of the things. So it was a huge mix of emotion. And I remember my family doctor, like, do you want me to drive you home? And I was like, no, you don't have to drive me home. I'll drive myself home. And I remember phoning my husband. He was at my mom and dad's house with our kids. And I was like, I need you to just like go home and meet me at home. Um, and it was my daughter's bedtime. And I was like, and don't put her to bed. I want to put her to bed. So I remember literally screaming and crying the entire way home. I phoned you. I remember I called you, and we had had a conversation, and you had reassured me that everything was going to be fine. And I remember like, no, it's not. Like, no, it isn't. Like, none of this is fine. I remember that conversation because, um, where we used to live, and like the drive to where we used to live, like when you're going up that kind of like hill where that big moose used to be, that big sign. I was like right there when I was on the phone with you. Um, and then I got home and I remember just like sitting in my driveway. And I remember my husband coming out and literally like lifting me out of the vehicle to bring me inside. And I remember crying so hard that like I don't, when it's raining so hard and your wipers can't keep up, it was like that, but it wasn't raining and it's just like my tears. Um, and then I remember getting home and I grabbed my daughter and we went up to her room and I remembered I was still nursing. Um, and I had asked my family doctor, like, can I still nurse? Like, is that a thing? Can I still do that? Um, and he was like, yeah, I can't see why not. Like you've done it already for this long that um and so I remember nursing her to sleep and I just remember crying and she had her little sleep sack on it and I remember her sleep sack being soaking wet just from me crying on her. Um and I remember asking my grandpa um to just like help, like help me through this. And I remember putting her to bed or down for her nap. And then I went to our room and like, I just remember just sobbing. Um, and then phoned my mom and dad and asked them to come over. Um, at that point, though, I had already told them. I feel like I had told most of my family roughly 3 months prior to that I had breast cancer. And they were all like, what in the right? Like, you are crazy. Like, what is going on? Um, and part of me did feel a little bit crazy just because I didn't have any symptoms. It was just this like internal gut feeling that I knew something wasn't right. Um, yeah. So initially it was just fear, relief, and then why me, right? Which you and I like talked about later on. And it's like we have to change that perspective from like, why is this happening to me? And change it to why is this happening for me? And it's funny because even 5 years out, there's still like those revelations that come through every once in a while, like, oh, it probably happened because of now look who I am versus who I was then, or like look at my priorities now versus what they were then. um there was so much, and I feel like I had prayed to be wrong for so long, even though I knew that I wasn't wrong. When you're just like you want to be wrong but you know that you're not wrong. um yeah, just that I think fear, but then thankful that someone, you know, that we were able to get what we needed to get to be able to confirm what I had known all along. Yeah. Um, and then after the biopsy results, everything moved relatively quickly. I was scheduled to meet my surgeon. So I was diagnosed on September 11th. And then like there was quite a lot of phone calls within like that first week. And then I had a patient care coordinator because there's a lot of people that you have to meet. And the soonest I could meet with the surgeon was October 19th. And I remember thinking, like, that's 6 weeks out. Like, I already waited 6 months for this diagnosis, and now I have to wait 6 weeks, which, and I understand 6 weeks is not long. Like, we are very privileged in that. I know that 6 weeks wasn't long, but it felt when it's confirmed that you have cancer inside your body, it feels like every single second of every day it is growing, right? And you can't wait to just get it out of your body. Um, so I remember saying like October 19th is way too far out. And I remember my patient care coordinator being like, I'm sorry, that's like the soonest we have. And I was like, I don't know, that seems kind of unacceptable. I just remember being like, um, which like I am that person. So I didn't change. That's just who I am. And I was like, well, there's gonna be like phone calls that you can make or like people that we can talk to speed things like, that timeline wasn't working on my timeline. And I remember praying to my grandpa, like, there's something before October 19th. This is insane. And the way that it works was you meet with your surgeon, go over the plan. Then you meet with your oncology team to discuss your treatment. Then I would do my treatment and I would go back to my surgeon and have surgery. Then I would meet my radiation team and we would do radiation. That was the initial plan. Um, so I remember like phoning almost every day, like, was there any cancellations? And I mean, obviously people aren't canceling these appointments, but I was dead set on getting an appointment before the 19th. And then I was like, well, I also have a bunch of questions. Like, I'm a 30-year-old mom who's breastfeeding. I have breastfed my daughter for the last year. I have a lot of questions. And so my teaching care coordinator was like, yeah, absolutely. Email them to me and I will pass them on to our medical leader. Um, and he will read them and I will, email you a reply, like a response to your question. So I don't know. I probably had a lot. I think I had, I want to say like anywhere between like 15 to 20 questions, I think. And luckily that she gave the medical leader my questions and he was like, who is this patient? Like, who is this mom that is, asking these questions and she's been diagnosed with breast cancer? What is going on? So he asked for my file and she had given him my file and he was like, okay, this is like a Friday, I'm gonna say Friday afternoon sometime. So, and it was like roughly about a week and a half to prior or after my diagnosis. So he told my patient care coordinator to let me know that he would meet me at a hospital in Edmonton at 7 a.m. on Monday morning. And so she phoned me at like, it was like 5, 6 o'clock on the Friday, which I thought was like a little bit odd, right? Um, and so she's like, I don't know if you know him. I don't know who you are. but he wants to meet you on Monday at 7 a.m. at this hospital in Edmonton. Like you have to be there. And I was like, absolutely, I will be there. And then she's like, and when you meet him, you need to thank him because he does not, he does not do this. Like he has not ever done this. And I was like, oh my goodness, okay, absolutely. And obviously that was, my angels and my grandpa kind of helping me out. And so Monday morning, we left like the house at like 3:30 in the morning. My mom came over to watch the kids, and we drove to the city. And I remember just sitting in this little tiny like cubicle room, um, had like the bed, and then like almost no room to even walk between like the bed and the counter. Like it was a tiny space. And I could hear the doctor outside, and he like talked really loud. And um he walked in, and immediately, and I've told you this, immediately I was so at ease, and I was like, I know you. I've known you before. Like it was just like that, like magical instant um like connection, not like a love connection, but like like you know someone, right? And he was wonderful, and he was like, it's stage two, but it was stage 1B or stage 2A. It really depends on who your doctor is. Like, yeah. um and he was like, you have, if you get breast cancer, this is the one you want. Which is, I hate when they say that, but I've heard other people like with other different cancers, like, oh, this is the, if you get lung cancer, this is the one. If you get skin cancer, this is the one you want. So he explained to me that I had triple positive breast cancer, which means that it feeds off of estrogen, progesterone, and also a HER2 molecule, which is just like a different protein that is attached. Um, and luckily, we now have done so many studies on HER2 positive breast cancer that there are a ton of immunotherapies that target specifically HER2 receptors, which is amazing. And so he was like, this is what we're going to do. And he's like, I know you're going to be upset, but we're not doing surgery yet. We're going to do chemo, and we're going to do immunotherapy. And then you're going to come back and you're going to see me. And then we're going to do surgery. And then you're going to have radiation. So, and I remember my husband and I being like, what? You're not like, we're not, we're not removing this cancer right now? Like that seemed insane to me. And he's like, no, we're not. We're going to do chemo first just to ensure that we can shrink any cancer that you do have. And the specific type of breast cancer that I had was invasive ductal carcinoma. And in my actual breast, there were no tumors. It had literally invaded my milk ducts, which again, my oncologist and my oncology team could still like not understand how I was still making milk, how I was still feeding my daughter and had breast cancer. And just so you know, you cannot transfer um, cancer that way. It's not a thing. Because I thought that it was. So um, cancer is not transferable in that sense. Um, and so there wasn't actually any tumor to remove except for that lymph node, which had stayed the same as 6 months prior. And so that was the plan. And from there, we met my oncology team, which again was, I remember sitting at the Cross Cancer, definitely being in at that time of my diagnosis, being the youngest patient there, um, in the breast cancer portion of it. Um, and I remember being so angry and so mad that I had to be there. Like, and I remember thinking, like, I can't believe that I have to take time away from my kids and time away from my family to be here. Like, I don't deserve this. I didn't do anything to deserve this. I do not belong here. Um, oh, and I just like, I can even like remember the first time pulling up to the cross cancer. If you've ever been there and you park underground. Oh, and I just remember hating, like, I really remember hating that place. And we go in, and I just remember being like super grouchy and super grumpy and just like, why am I? And um, I can like sense exactly how I felt in that moment. And um, we were waiting and waiting and waiting, and my oncologist wasn't coming, and I hadn't been called up yet. And I remember going to the front, and I'm like, I had an appointment at this time. And she's like, I know, I'm sorry, like we're just running behind. Um, and then finally they bring us back into a room, and they're like, you're gonna see so and so. And so I'm like, okay. And I'm like, I'm gonna go on Rate MD and just like, find out who this doctor is. And my oncologist has a very common name. And so I'm on Rate MD, and I find I who I thought was him. And it was just like not good. And I remember reading some of the things to my husband, and he was like, maybe you'll have to ask for a different doctor. And I was like, oh my God. Um, and then, like knock, knock, knock. And then they come in, and it wasn't him. It wasn't the Rate MD doctor that I had read about. Um, and in that moment, meeting my oncologist, I had every bit of faith in the world that he was going to make me better. He was the kindest and nicest person again I had known him before. Like, um, our souls had known each other. We just had like this immediate connection. And I was just like, I, I mean, you're at the mercy of doctors at that point, um, because you know that, of course, there's other things that you can do, but when you're just like new to it, you have no idea what's going on or what's happening. You really are just like, please, anyone, make me better, right? Help me, fix me. Um, and so he like wrote down a thing, and he like wrote down all the plans, and this is what we're going to do, and then this is what we would do, and then this is what we'd do, and this is the medication you're going to be on, blah blah blah. And I remember him specifically, like he wrote down cure, like we're not we're not looking to like treat you forever, we're looking to cure you forever. That is the ultimate goal. And then he's like, okay, well, it was great meeting you. Here's like the information. Here's some information. And I was like, okay, like, but when do I come back? And he's like, oh, no, no, like, I'm going to give you time. You're going to go home. You're going to like discuss with your family. And I was like, definitely not. No, like, I'm not leaving here until we have an appointment because um, like, I'm the smartest one in my family that I know. So I'm gonna make the decision. It's gonna be my decision. And he was like, oh, okay. And I was like, and honestly, like I have literally researched everything that I already knew the treatment I was going to be on. I already knew the chemo that he was going to put me on. I already knew the immunotherapy I was going to be on. I already knew like the cycle that we were going to do. I like, and when I had told him that, he was like, oh, like what medical background do you have? What do you do for work? I was like, I do not have a medical background. I just have a type A personality that like will research till the end of time. Um, and so I remember leaving there, Definitely feeling better, feeling grateful for the doctor that I was given. Um, and then it was like, hey, you're going to go for an MRI. We're going to check the rest of your body. You're going to go for a CT scan. We're going to check your bones. We're going to do all of that stuff, make sure the cancer hasn't spread. And you'll be back in 3 weeks and we're going to start treatment. And that's it. Um, so we, I want to say like a week or so after we were back in the city, getting all of my scans done. And we were doing them not at the cross cancer. My family doctor had already gone ahead and scheduled and booked everything I was going to need because he just wanted to like get ahead of it so that we weren't waiting so long for everything. And I remember I had done one scan and then we had a break in between. So my husband and I went for lunch and we were pulling back in and I get a phone call and it's my family doctor. And I was like, how weird, how strange. And so I pick up and just instant, like my heart had fallen. He didn't even say anything. And my heart, like, I just knew that something wasn't right. And he's like, hey, Ash, what are you doing? And I'm like, what do you want? Like, why are you calling me? Like, I don't want to make small talk. What do you want? Um, and he's like, so I just got the report back from your first scan and it's not great. And like all of my fears um were all coming true is what like just everything that I had ever been so terrified of in my life was literally hitting me in the face. And so I was like, what do you mean? What's going on? And he's like, so your scan, the doctor who reviewed your scan said that there is something on your left lung and it is looking a lot like breast cancer. It's like identifying itself and portraying itself to look exactly like breast cancer. And I was like, okay, what does that mean? And he's like, that means that your cancer has spread and um, you're now stage 4. And immediately, because I knew the statistics, there is no cure for stage 4. You can go into remission. Um, it's very unlikely that you stay in remission, although there are people who have. Um, and I know that miracles can happen. So um, I was like, well, like, what do I do now? And he's like, well, you could like go back and you got to finish your other scans. And I'm going to get on the phone and I'm going to phone your surgeon and I'm going to phone your oncology team and we'll get, we'll get everything figured out. We'll get everything sorted out that, we need to do. And that was like a Friday around 1:30, 2 o'clock. Um, But then I remember going back in for my other scan and I again remember just being like so angry. Um, and I remember the lady, so for a lot of these scans, you have to have like a contrast dye injected into your body. So they give you IVs and then they inject you while you're in the machine. And the lady was like getting my IV set up and um I don't remember what she had asked me, but I remember being like, it doesn't even matter because my cancer is stage 4. And I remember the look on her face, just like stunned almost. And she was like, oh my gosh, I'm so sorry. And I go in, we do the one scan, then I get like moved to another room. And they're like, oh yeah, we found a spot on your collarbone. Um, that we need to like look at. Have you ever like injured your collarbone or anything? And I was like, yeah, I'm pretty sure I've injured my collarbone. Like, I don't remember exactly when, but like I'm pretty sure it's been injured before. And so he's like, hey, I just have to like take closer images of your collarbone and then we're going to review it really quickly. And if I come back in and let you go, it means it's all good. But if I come back in and we have to take more pictures, it means it's not great. I'm like, great, great. Um, and I remember he like we're taking pictures and then he like came through on the little intercom and he was like, hey, that's it. We're all good. You can get up and like go change. And I was like, oh, okay, so that's good. And later on, I found out that, like, yeah, it had been fractured or something. But a lot of times when you fracture bones or things that can't be set back into place, they'll always kind of have a bit of a shadow. And a lot of times, those types of things are not noted on your chart, which is like a thing I didn't know about that. But so now I just like if it's a new person or if like I'm meeting a new doctor or we're doing new scans, I'll always just like, hey, just a heads up, my collarbone was like fractured before. That gray shadow that you see is not cancer. Um, right? Like obviously if it looks different from scan to scan, then yeah, maybe it's something that we need to look into, but it's always been very consistent. Um, and then I remember my family doctor phoning me that night and was like, I couldn't get a hold of anybody. Your surgeon was gone for the weekend. Your oncologist is out of town. And obviously at that point, um, like the amount of fear that I had and just everything that I had read and the rabbit hole that I had put myself down, just like knew it wasn't good. Um, and it's so crazy what fear can do to you. And I didn't really realize that until I was put in this situation. Because I don't really think I had ever really been scared of, I mean, like, yeah, I haven't really been scared of anything. Um, but then when you're told that you are gonna die, which I mean, we are all gonna die, but when you're told that now you have like an expiry date, so to say, um, it really makes you look at things very differently. And also, like, really, I'm obviously we know that we are going to leave Earth at some point, but I guess I honestly had never really given it much thought. And I really had not really ever thought about dying. I never thought about leaving my kids. I never thought about leaving my husband. I never thought about leaving my family. Um, I guess we kind of live in like that naivety of like, it's not going to happen to, you know what I mean? Like we know it's going to happen, but you just don't think about it. Um, and I want to say around 7 o'clock that night, I get a phone call um, from my oncologist. And I remember his name came up and it was a totally different number. It was his private cell phone. And I ran upstairs and I remember sitting on the edge. This part's gonna make me cry. I remember sitting on the edge of my bed. And he was like, hey Ashley, I just got a message from your family doctor and I took a look at your scans and like I hate to have to tell you, um, but you don't have stage 2 breast cancer, you have stage 4 breast cancer. Which I was like, again, because I had almost like convinced myself that I did because I had gone through that like rabbit hole of researching everything. Um, and I was just like, what does that mean? Like, I have a daughter that's not even one, you know, my son is 3, um, 4, he was 4. Um, and he was like, and I just asked, I'm like, do we know how long I have? Um, and he was like, no, and I don't normally give time frames because everyone is so very different. You haven't even um we don't even know how the chemo will work yet. We don't know anything. So, and at that point, I had already had um, my first round of chemotherapy. And he was like, but one round, we're not going to know what happens in one round. So, but he's like, I am going to change your treatment a little bit, and I'm going to change the immunotherapy that you get. Um, because it's now stage 4, we can kind of get better drugs at this point. Um, and then he said, I will do everything I can to keep you here for as long as I can. And I remember crying on the phone, obviously. And I remember him crying, like, because he was like, we don't ever do this. We're like never supposed to give patients news over the phone ever. Like, you have to come in and then we will tell you. Um, and he's like, but your family doctor is so persistent. um, and I remember thanking him. And he was like, because he was um out of the province on holidays. And he was like, as soon as I get back, we will have a new plan. We will have new drugs. And when you come back for your second round of treatment, it will be slightly different. Um, and I just remember thinking, like, I knew it, I knew it, I knew it. Um, and then, you and I have talked about this a lot, but like, we manifest what we think, right? And I'm just like, did I do this? Is it my fault that this happened because I just like knew that I was going to have stage 4 cancer because it took forever for me to get diagnosed? Or like, how did that happen? How did all of those doctors that I went to, all of the ultrasounds that I had, how did everything get missed? I didn't have a cough. I had zero symptoms of anything being on my lung. Um, I was just so frustrated. I remember just being so frustrated and so mad, and um just like, this could have been avoided. If someone had listened to me 6 months prior, it could have been avoided. Um Knowing what I know now, no, nothing would have changed. 6 months prior would have been the exact same diagnosis. Um and then from there, um things got um things were very confusing and very complicated for about 6 months, I'd say. Um, so we did treatment, we did chemo, we did immunotherapy. I did the 6 rounds of dose Taxol, which is like what makes you lose your hair and can make you really sick. Um, and after those 6 rounds, we did a scan to see how well the treatment had worked. So, given that my breast cancer diagnosis had changed from a stage 2 to a stage 4, I was no longer eligible for surgery. So that had been taken off the table. And I was no longer eligible for radiation. So my only option was chemotherapy and then immunotherapy until immunotherapy didn't work. And then we'd try something else. Um, so we did the scan. The breast cancer in my breast and the lymph node completely gone. I had a complete response to that treatment in my breast. On my lung, things had progressed. I now had some thoracic nodes that looked roughly a little bit enlarged. The spot on my lung, there was like multiple kind of spots now on my lung. So just not great news. And I remember asking, like, how does that happen? How do I have a complete response in one spot and not the other? And my oncologist said, like, it's not uncommon. It's not very common. Normally, if it works everywhere. But he said it's not unheard of. It has happened to some of my patients before. Um, so we'll just keep going. And I remember being like, no, I think we need to find someone who will biopsy my lung. And he was like, oh, I doubt, I doubt that we can find somebody to do that. And I was like, no, I'm like, I find it very odd. I find it very odd that I had a complete response, but not here. And then he's like, you know what? I agree. I agree. I think that this might warrant, um, you know, maybe taking your case to the tumor board and kind of seeing what they think. So the tumor board is just a group of surgeons, radiologists, oncologists, general practitioners, literally just a group of doctors who all practice different things, who come together and kind of give their opinions on very complex cases. And so he's like, it's going to be a little bit, we're not meeting till, I think they meet once a week, and every board meets a different day of the week. So they weren't meeting till the following week. And then he was like, I'll give you a call and kind of let you know what we discussed and what we decided. So he phoned me, roughly a week or so later, and was like, okay, so I brought it to the tumor board, and he said it was very interesting. Someone asked if you had ever been diagnosed with an autoimmune disorder. And I said, oh, okay, that's interesting. I haven't. And he said, no, that's what I said. Like you've never been diagnosed with an autoimmune disorder. When you presented initially, you looked like a very healthy, not someone who had cancer. Um, and so he said, and there was suggestions that biopsies be done so that we can better treat it. If it is breast cancer, perhaps it's a different type of breast cancer, perhaps it feeds off of something else, or we just need to change treatment. And he said, and there was one radiologist who agreed to biopsy your lung and your thoracic lymph nodes. And I said, okay, perfect. um and he said, but like, I have to remind you, um it's super dangerous. Like, we don't really like to do that. And he's like, so even the fact that like this radiologist, um, lung doctor, sorry, he's not a radiologist. He is a respiratory oncologist, and then he's also like a respiratory doctor anyway. So, and then he said, it was brought up that perhaps it will come out as being an autoimmune disorder. Maybe it's not cancer. And I said, okay. And he said, but like, there's like a 99.9% chance that it is breast cancer. I don't want to give you this false sense of hope, you know? And I said, I understand that, but there's still like 0.1%. Like, there's still that one person out of 100 people. There was still that person who was not breast cancer. So, and he's like, I know, but like the odds are not good. Like, the odds are not in your favor. And I'm like, I understand that, but at this point, like, you've already given me the worst news. Like, I am dying. I am going to die. So, you know, you can't give me any other bad news, right? Like, that's just where we're at. And so he's like, Kate, I'll schedule that. They'll call you, they'll book all of that. You'll go in, you'll meet with this doctor. He will explain everything to you. So we did that. At that point, I was still doing immunotherapy. Because I had a complete response in my breast, we decided to wait until we got the biopsy from the lung, just so that we know what the next, course of action would be. So I go in and I meet this respiratory oncologist, and he's like, yeah, I don't think it's breast cancer. And I was like, oh, and he's like, and then he had my x-ray up and he's like, see this, like, see what it looks like? Yeah, doesn't look like breast cancer to me. And I was like, oh, okay. And he's like, it does look like sarcoidosis, which is an autoimmune disorder. And he's like, again, not great. And I'm like, yes, not great, but like, I'm not going to die. Like, if we're told that that's what it is, my diagnosis goes back to being early stage breast cancer with a cure. Like, right? And he's like, don't get your, like, I don't want you to get your hopes up. If I call you, that's good news. If your oncologist calls you, um, it's not good news. And I said, okay, that's fair. And then, he just went over everything. Your lung can deflate. We might have to pump your lung back up. There's a bunch of complications. You could bleed. You can, and I was like, okay, right? Like you're kind of, I don't have any other choice at this point. And I really trusted him. He was very knowledgeable, and um, I still actually see him to this day. Um, and so I want to say about 2 weeks later, he called me. He called me. I saw his number come up on the phone, and I just remember I was already crying before I answered because he had said, "If I call you, it's good news." And I remember I had just put my kids down for their nap, and I answered the phone, and he's like, "Oh, is Ashley there?" And I'm like, "This is," and he's like, "Hey, so I have some news. It's not great news. You have sarcoidosis." And I was like, that is literally the best news. That is the best thing that you could tell me. And he's like, well, no, like the best thing I could have told you is that like it was nothing. And I was like, yeah, but we knew that that wasn't a thing. So this is the best, possible news. And yeah, I remember crying on the phone and he was like, okay, I'm going to send over a letter to your oncologist and kind of let them know. And then you guys can, figure out a treatment plan from there or, whatever the case may be. Um, and then like I'll be in touch and we'll like keep following you for sarcoidosis. So I remember hanging up the phone and I remember phoning my oncologist's office. And at this point, his receptionist and I had actually become friends and we're still friends. Um, and so I phoned her and I'm like, you'll never guess what happened. She's like, oh my God, what happened? And I'm like, uh, my doctor was wrong. She's like, oh my God, that's the best news ever. Um, and then she's like, yeah, I'm gonna put you through. I'll put you through. Hang on. And so I remember he comes up, it comes on to the phone, and I was like, you were wrong, you were wrong. Like, and I remember him being like, I have never been so happy in my life to have been wrong. Right? Like everything pointed to it being breast cancer. We don't normally biopsy, like we don't normally go around like fishing for for stuff. We, you know, and that is a common thing and that is a known thing that you don't normally play around with those things. There's a possibility of if you take a biopsy from cancer and as you're pulling it out there's potential for breast cancer cells to be on the tool to then spread to other tissues, like those are known things. um but in that moment we were both just so thankful that he was wrong. And even when I would talk to him like years after, and he's just like, and he had been practicing oncology and had been an oncologist for over 30 years. And I was his very first patient, that had kind of made him realize that there is a gray area. Not everything needs to be black and white. Um, there's actually a lot of things that look like something but can be something else. And the more that I think about it, and even like I thought about it like when we were going through all of that, I remember like praying to my grandpa and praying to my husband's dad, and um just to, basically any angel that would listen, or any energy that would listen, um to just help me and to just give me just a little bit more time, just give me a little bit more time, because the odds weren't very good that I was gonna see my daughter turn 5 or see my son turn 8. um and my kids are now 6 and 9, so um which is pretty incredible. And just to have everything kind of turn around. And then I was fortunate enough to have surgery be put back on the table and to have radiation put back on the table. um yeah, just amazing. And obviously that is like 8 months, I want to say, kind of like through that time. In those 8 months, you and I had had many conversations. You had done many Reiki sessions. You had um, you had told me to go to like this different practitioner and this different practitioner, which I all did. I also seeked out help from naturopaths, which those were amazing, and Rufus, and a huge, huge help. Um, just so many things, and I feel that like there was so many come here, there was so many like synchronicities that there was so many synchronicities that obviously um all of those things were meant to happen for a reason, right? Like all of those like trials and tribulations, I guess, to kind of get to a different place. And now like my perspective has changed. Who I am as a person has changed. You would know because you knew me um throughout that entire like trajectory. um just so obviously those things had to happen, or I just would not have changed who I was as a person, who I was as a parent, who I was as a wife, who I was as a friend, as a daughter. um just so many things. Yeah, or like I think about it now. And sometimes when I think about it, it feels like a lifetime ago. But then sometimes when I think about it, it feels like it was yesterday. Um, yeah. And so, yeah, I was able to have surgery. Um, and we did radiation. I did radiation, only because I wanted to. We did preventative radiation. So I did 25 rounds of that. And then I did hormone therapy, and I continued to see my naturopath. And there's a lot of like things like behind the scenes and stuff that were done. And I did do a lot of like homeopathic things, and there is a lot of benefit to doing homeopathic remedies. And if you are able to find a really good homeopathic doctor. The one that I was able to find was actually a homeopathic oncologist. So he was able to find things for me that would help with my treatment. So I still did chemotherapy, I still did immunotherapy, and he was all for that. Um, but then was also able to supplement me with other things that would um, help ease, my discomfort and help the chemotherapy work better and more effectively. And um, if you're able to, that is such a great resource. And my oncologist was on board with it. I was just in that realm. I was just so blessed to have the people on my team that I did, and everyone just listened to me, which was so, I felt like that was so important. Um, because a lot of times you feel not heard and kind of dismissed whereas everyone listened to me. And even though I probably sounded like I was losing my mind half of the time, everyone just listened and was like, okay, yeah, we will try that. Yep, we can see if somebody can do that. Yeah, we can look into that. We can. I was so fortunate, but obviously, I know that there was so much more at play. Like my um my angels definitely helped so much. Um, yeah, that's like the gist of it. There's obviously like way more stuff, but I've already been talking for like an hour.
I think that's so powerful that you were able to trust your gut. And, most people would just believe the doctor the first time
Mhm,
and just let it go until those physical symptoms manifested even more.
mhm,
And yeah, I feel like it's so important to listen to that inner knowing and not give your power away and advocate for yourself like you were able to throughout that whole time. And I just remember how much you prayed during that time. Like every night you were calling in your angels, your divine team, your grandpa, your father-in-law, and you just had that extra layer of support. And I feel like miracles and so much magic can happen when you do call them in, and it's available to each and every one of us. We just have to ask because of free will. They can not intervene unless it's an emergency. So thank you for sharing all of that. I'm honestly, a lot of it I remembered, but there was also some of it that I didn't. And just the strength that you had to get through that. And when, so when was it that your scan came completely clear? Like how many months were you going through treatment until that happened?
So I have never, this is tricky. I personally have never had a clear scan
Oh, okay.
because of the sarcoidosis.
Right.
And this is something also to just keep in mind. Not every radiologist who is going to scan you is going to look at your history. So I have had many scans that have come back like, oh, like metastases to the lung. And we're like, no, you just got to look back a couple scans and it'll tell you that I actually have sarcoidosis. I have an autoimmune disorder. Um, so we know the scans are clear, but like there's never been like an all clear and like I have had many scans. I have now chosen to no longer be scanned because of that. Um the PTSD is so strong, and even though I know what is true, it's really difficult when you read a report from a doctor who says, no, you do still have cancer, you're just not in treatment. And I'm like, no, that's not the case. And I've actually, um, not that long ago, 2 years ago, I had an argument with a doctor, with a gastroenterologist who um, literally told me, I remember the conversation on the phone, was like, I need to send you back to your oncologist because you have metastases in your lung and you're just not treating it. And I was like, no, I don't. If you go back, my lung has been biopsied and my thoracic lymph nodes have been biopsied, and I do not have breast cancer that has metastasized. I have sarcoidosis. And over the course of those 5 years, my sarcoidosis has shown up on my liver and has shown up on my spleen. Um, and I know that you have to be at the very end stages of your life for cancer to show up on your spleen. Your spleen is a sponge, and it's one of those types of organs that cancer doesn't normally stick to. So I knew I wasn't at the end of my life. I looked like a perfectly healthy human being. And yeah, I remember having that argument with him. Um, And I was like, well, you're wrong. And you need to just, and he was like, well, you've never had your lung biopsy or you've never had your liver biopsied. And I said, you're right. I haven't ever had my liver biopsied. If you would like to schedule that, I will gladly go for a biopsy. Um, because I would love to just like have it on paper that basically every organ of mine has been biopsied and we know what's going on and there is no breast cancer that has metastasized anywhere. And so he did agree with me and he did um, send me to go get an ultrasound guided liver biopsy. And I remember sitting in the room with the technician he was just looking for the spot for the liver and then the doctor was going to come in and do the biopsy. And so he's like checking, and he's like, I don't know, I don't see anything anywhere on your liver. And I was like, I don't know, keep looking because he swears that there's something on my liver. So he like goes over it, takes a bunch of images, can't find anything, calls in the doctor. Um, the doctor takes a look at it and he's like, oh, yeah, I guess the spot's gone. And I was like, yeah, that would make sense because sarcoidosis can kind of come and go. That's a very um, that's a very normal thing for that specific type of autoimmune disorder. Um, and I have always been asymptomatic. I've never shown any symptoms of having sarcoidosis. So we were all aware of like the spot on my or the spot on my liver and the spot on my spleen. Um, and like my oncologist was aware of it. Everyone was aware of it. Um, so yeah, that part is really difficult, and a lot of doctors obviously like he did not care to have my opinion because he's like, you're not a medical doctor, which yes, I am aware I am not a medical doctor, but having had to fight for my diagnosis and then having had to fight for all of the other things that I had to go through, I was like, I'm not doing these unnecessary scans and I'm not doing all of this unnecessary testing when I know that I'm right. And he ended up apologizing and I ended up getting a different doctor.
I think, again, just trusting your own inner knowing,
Mm-hmm.
right? It's really easy to get in fear
Mm-hmm.
after
Oh, and
everything.
I remember like having that fear because when somebody tells you something, even when you know it's not right, there's still a little bit of like fear attached to that.
Mhm.
And it kind of took everything in me to be like, no, you're wrong. You're wrong, you're wrong, you're wrong. I don't need to be in treatment. Like, you are wrong. Um, and then I remember getting off the phone and I went in the living room and I was talking to my husband and I was like, he wants me to do all these tests and he blah blah blah. And he was like, don't do them. Like, you know. And I was like, I know. But
Yeah,
it's hard, right? But it's just like trusting yourself and trusting your gut.
yeah. It's just so important. I remember too, like that was a lot, and that would come up during your sessions, if you don't mind me sharing, is like
Yeah,
scan. You can scan throughout the day, throughout the week, throughout the year, and it's gonna different things are gonna show up, right? Yes, they're great to have, but you can't base 100% accuracy on what's gonna show up. So I think it's really important to trust yourself too. Hey, beautiful. I want to thank you so much for sharing your story. I do have some questions for you, but if it's okay, we'll do a part two just so the video is not
yeah,
super long.
sure,
Really interested just to see like your mindset, how spirituality helped, kind of dive more into the holistic treatments that you were doing during that time if you're open.
for
Okay,
sure.
so we will come back with part two. Thank you.